Hi, good morning Schofield. My name is Mihira. I'm your invigilator for the OET-speaking session on the 17th of June 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Schofield Kammer.
And could you confirm your candidate number?
My candidate number is 222811118.
All right, are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Okay. Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
How do you handle a situation where your replacement does not arrive on time?
I contact my replacement roughly an hour before my shift ends to ensure that they would arrive on time. If they communicate that there might be a delay or absence, I help them find a substitute to take their shift, or inform the senior nurse or doctor when I cannot find the substitute. In either case, I make sure to not leave my post until my replacement arrives.
How would you handle a patient who struggles with pain management?
I have worked as a nurse in a gynecology ward. Since many new mothers breastfeed their babies, we are advised to not put them on strong pain medication or anesthesia. But the pain can become difficult for patients to handle. I usually stay by their side during these times and help provide alternate pain relief measures, like balms, oils, massages, breathing, and stretching exercises, etc.
How would you handle a disagreement with a doctor?
Doctors may handle a lot more patients than nurses. Sometimes, it becomes difficult for them to keep track of medical records and patients' histories accurately. When there is a discrepancy between the doctor's instructions and a patient's medical records, I discuss the issue in detail with the doctor to get it resolved before we take any further action. When we cannot resolve it, we take a mutual decision to escalate it to a supervisor.
Describe how you manage a busy workload.
Whenever there are too many tasks ahead of me in a shift, I sit with the other nurses to split all our tasks into smaller components and handle them one at a time. Usually, we devise a workflow where a single person handles similar tasks. This way, we increase speed and efficiency by working in groups and delegating tasks effectively.
How would you handle a crisis, such as an outbreak?
During monsoons, malaria and dengue outbreaks are common in my city and its peripheral areas. In these periods, we see a lot of patients with the same range of symptoms. I have participated in awareness drives with the assistance of the City Health Department, hospital associations, and several NGOs. I have realized from my personal experience that it is easier to prevent such outbreaks than to handle them at their peaks.
Great. Thank you very much for sharing that. So, let's move on to roleplay now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the roleplay is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the roleplay as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The roleplay will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the roleplay, please?
Hello, good morning, Mihira. I am Schofield, your attending nurse here today. How are you feeling now?
I'm feeling okay, I guess. But I'm a bit sore and tired.
I understand. Don't worry, Mihira, you had a major surgery, and it's normal to feel some discomfort during the recovery period. Mihira, I am here to check your vital signs and do your wound dressing. Do you have any questions?
Well, I feel some pain. It hurts a little when I move or cough.
Oh, I see. On a scale of 1 to 10, how would you rate your pain?
Maybe a 4 or 5.
Okay, that's not too bad. The pain at this level, after the surgery, is normal. But, if you need some pain medication, just let me know. I can give you some, as prescribed by your doctor.
Sure, I will let you know. Thank you, nurse.
You're welcome. Now, I would like to know about your fluid intake.
Not much, to be honest. I don't feel very thirsty.
Well, Mihira, it's very important to drink enough fluids after kidney surgery. It helps to flush out toxins and prevent kidney stones or infections. You should aim for at least 2 liters of water or juice per day.
Really? That sounds like a lot.
Trust me, it's for your own good. Try to consume a glass of water every hour. You can also have some juice, if you prefer. Just avoid anything with caffeine or alcohol, okay?
Okay, fine.
Good job. Now, let's talk about your food. How about your food intake?
To be open, I don't like the hospital food. It was bland and boring. Just some rice and boiled vegetables. No salt, no spice, no flavor at all.
I'm sorry to hear that. Mihira, I know, it's not very appetizing. But, there's a reason why you have to follow a diet restriction after kidney surgery.
Why is that?
Kidneys are responsible for filtering out the waste and excess fluids from your blood. When they are damaged or removed, they cannot do their job properly. That means you have to be careful about what you eat and drink. Some foods can cause more strain on your kidneys or increase the risk of complications and infections.
Like what?
For example, foods that are high in sodium, potassium, phosphorus, or protein can be harmful to your kidneys by making your kidneys work harder.
Oh, I didn't know that.
That's why you have to limit these foods in your diet until your kidneys recover. Your doctor will tell you how much of each nutrient you can have per day, based on your blood tests and kidney function.
So, what can I eat then?
Don't worry, Mihira, there are still plenty of options for you to choose from within the diet restriction. You must consume a kidney-friendly diet, that is, foods with low potassium, low phosphorus, low sodium, and low protein, such as fruits, vegetables, grains, dairy, lean meats, nuts, and seeds. You can also use herbs and spices to enhance the taste of the food, but should avoid salt and other sauces that are high in sodium.
Okay, I will.
Good to hear. I hope you found this information helpful. Here is a booklet that has more details about the kidney-friendly diet and some recipes you can try at home.
Thank you, this is very useful.
You're welcome. I also recommend that you see a dietitian who can help you plan your meals and monitor your nutrition. Would you like me to coordinate a dietitian with you?
Yes, please. That would be great.
All right, I'll make an appointment for you and let you know the details.
Thank you so much, nurse. You're very kind and helpful.
You're very welcome, Mihira. It's my pleasure to help you. I want you to recover well and enjoy your food. Just remember that the diet restriction is temporary and will be lifted gradually as your kidneys function properly.
I understand. Thank you for explaining everything to me.
No problem. Do you have any other questions or concerns?
No, not right now.
Okay then. Can I have your consent to do clinical checks and wound dressing?
Sure, go ahead.
Thank you for your consent, Mihira.
That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihira.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.